بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. اللهم أخرجنا من ظلمات الوهم وأكرمنا بنور الفهم وافتح علينا بمعرفة العلم وسهل أخلاقنا بالحلم. اللهم ارزقني نعمة الإخلاص لوجهك الكريم بكل ما أقول وبكل ما أفعل. آمين يا رب العالمين. My topic today is a short talk about snow-related signs in diagnostic imaging. Here I will discuss the snowman sign and its differential diagnosis and some examples, snowstorm sign or appearance and some examples, and others related to snow signs. Snowman sign, as we see here, this is a snowman sign. As we see here in this BHS in patient with total anomalous pulmonary venous return, and we see here dilatation of the right and left innominate veins and superior vena cava, giving the appearance of the classic snowman or figure of 8 appearance. And also there is dilatation of the heart or enlargement of the heart, and also there is increased vascularity. The superior mediastinum is enlarged, as we see here, due to right superior vena cava and innominate vein and ascending vertical vein on the left side. Here another patient with total anomalous pulmonary venous return, supraventricular type with the snowman sign, as we see here, and we see the dilated superior vena cava on the right side and dilated anomalous vein or vertical vein on the left side, and also we see the heart silhouette is enlarged. Here is another example of snowman sign in patient with pituitary macroadenoma. As we see here, the pituitary gland is enlarged with giving the appearance of the snowman sign. Another patient with pituitary macroadenoma giving the appearance of snowman sign. Here, this is another patient with looks like figure of 8 or snowman sign or hourglass sign in patient with schwannoma, trigeminal schwannoma, involving the causing and expanding of the Meckel's cave. In this axial cut MRI. Another patient with figure of 8 appearance in patient with lissencephaly, as we see in this example. Here another rare shape lipoma involving the chest wall, giving the appearance of the figure of 8 or hourglass shape mass. Snowstorm sign or appearance, as we see here in this examples. It is seen in thyroid metastasis, as we see here the pHs with multiple and numerous nodules involving both lungs, and these are small signs, small nodules. Here, another patient with thyroid metastasis with multiple small nodules involving both lungs. Here, this is patient with complete hydatiform mole, as we see here the ultrasound of the uterus with the classic bunch of snowstorm appearance of uterine cavity or bunched over crepes in patient with hydatiform mole or gestational trophoblastic disease. Here, another patient with the snowstorm sign in patient with microlithiasis, testicular microlithiasis involving the right testis, and presented as hyperechoic calcific foci without acoustic shadowing involving the right testis. Here, another patient with testicular microlithiasis. Here, this patient with silicoma contains silicoma particle, and here this is rupture silicone implants giving the appearance of snowstorm appearance. As we see here, and this rupture outside, and this is the contained silicoma here in another example. Here, patient with synovial chondromatosis giving the appearance of the snowstorm appearance. Other snowstorm signs or related signs like snow cap sign, is driven snow sign, or falling snow or snowflake sign. Here, this patient with the snow cap sign, as we see here, density involving the head of the humerus in patient with a vascular necrosis giving the appearance of snow cap. Also, we see here the head is flattened, and in this patient with a vascular necrosis. Here, this patient with hydrated cyst with snowflakes appearance in the hydrated cyst with acoustic enhancement of the hydrated cyst. Here, another patient with hydrated cyst with acoustic enhancement and snowflake sign, as we see here. Here, this patient with the spermatocele with large anechoic cyst containing hyperechoic foci due to spermatozoids, giving the appearance of falling snow sign. Here, patient with calcifying epithelial odontogenic tumor. This is the panorama view, and we see here mixed radiolucent lesion involving the right mandible, giving the and displacement of the mandibular and maxillary teeth, giving the appearance of a driven snow sign. Here, this is the CT scan of this patient with well-defined heterogeneous tumor involving the right side of the mandible with multiple irregular calcification giving the appearance of a snowflake sign as we see here. Thank you very much for listening and hoping to see you soon in another talk. سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك.